Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Years of neglect and a lack of funding has left the vast majority of people with mental health problems struggling without the help they need, according to a damning report. The independent task force said inadequate care was leading to thousands of tragic and unnecessary deaths. The government has now pledged £1 billion in new funds by 2020. But will it really reach those who need it most? Simeon Brown reports.
Sometimes the most ferocious fights we face happen in silence.
I never told anybody because I thought I didn't know what it was. I just knew that my mood was really, really low. And I was thoughts of self-harm and eventually kind of self-destruction set in because I felt that I wasn't worthy and was a burden.
Margaret, not her real name, works in a competitive industry. She feels she has to keep her mental health challenges hidden from colleagues because of the stigma it still carries. Today, an NHS task force revealed a range of concerns with mental health services and has called for the kind of crisis care done here to be made available 24/7.
This team is what's known as a home treatment team. So what we do is we see people when they're in a crisis. There are services that can come to you. We will go to your home. We will see you twice a day. We expect to see you on the day you refer to us. And my instinct is a lot of people don't know that that sort of service exists.
Only half of community mental health teams in England are able to offer round-the-clock support, according to a review from the Care Quality Commission.
Now, in response, the government has pledged £1 billion in additional funding to support 1 million more people by 2020. Now, figures like this can appear abstract, but I'll tell you why they're anything but. 1 in 4 of us will experience mental health challenges at some point in our lives, which means that if you don't, almost certainly somebody you know will.
For some groups, the risks are higher, and in the past, those from Black and Asian backgrounds have felt overlooked. Men of African and Caribbean heritage are up to 6.6 times more likely to be admitted as inpatients or detained under the Mental Health Act.
Stereotypes are operating in how maybe the police interact with the black community, how teachers interact with the black community, how health services interact with the black community, that mean maybe in the terms of diagnosis, like there's an over-representation of black people with schizophrenia. Actually, a lack of cultural understanding means that you'll diagnose disproportionately than other communities.
So a challenge for the Prime Minister David Cameron. He says despite the progress made tackling mental health stigma, more must be done. A message that resonates with Margaret.
I think there is quite a lot of stigma surrounding mental health. There shouldn't be really. I mean, you know, other stigmas have disappeared, like same-sex marriage. So I suppose mental health should be in a similar position, i.e. to talk about it rather than sweep it under the carpet. With the support I've had here, I have got a purpose and I have got a future.
Well, with me now is the actress and mental health campaigner Ruby Wax, who suffered from depression herself, and the Conservative MP James Morris, who is the chair of the all-party parliamentary group on mental health. I mean, Ruby Wax, give us a further sense of this problem, because apart from your own experience, you get the experience of ordinary people through your show.
Well, in the second half of my show, and I've been doing this for about 7 years, the audience are allowed to stand up and talk about their situation. This is the British. I'm not performing in specific regions or circumstances. You see these people, sometimes they're tearing their hair out. It's a comedy show that I'm doing, but they have nowhere else to go. So they stand up and say they've been waiting for 2 years, they can't get help. I have despairing mothers with daughters saying, I don't know. Sometimes they stand up, a few people have said, I've had cancer and depression, and the cancer is, it's much easier because with the cancer, all I wanted to do was live, and with the depression, I just wanted to die. I mean, these people are kind of, there's an outpouring because A, there's nowhere to go, and I say, well, I can't do anything, but I tried to have walk-in centers once a week while I was doing the show, and I'd bring them kind of armies of therapists. But there's still an outcry. Where do they go? How do they meet? Because there's such shame involved. So I'm starting walk-in centers in the next few weeks to go out across the UK.
And do you have a clear sense of what is needed, what would work?
Well, parity between physical and mental wouldn't be bad, because good luck holding a job down if you've got a mental illness, and the discrimination and the stigma. And you think, well, why hasn't anything been done before? The number's 1 in 4, so if it's not you, it's your mother or your aunt. So I don't understand why it's suddenly, I'm glad some money's going there, but how are we going to chase it? How are we going to track? You know, to say I'm breaking a stigma, that's a very difficult thing to follow.
James Morris, if you talk to people who talk to mental health trusts, vast numbers of them will say, in fact, the budgets have gone down.
Well, that's one of the issues that we have, that we've got. It's not just a question of funding, it's a question we've got systems and cultural problems within the NHS. And what's happening is, despite the intention of actually raising investment in mental health, a lot of local commissioning decisions are not prioritising mental health. So funding is important, and this report today, chaired by Paul Farmer, is a massive step forward in mapping out a strategy for mental health. But there are very profound systems and cultural problems within our NHS which need to be addressed if we are to move forward.
And why haven't they been?
Yeah.
Because people have been talking about this for years.
They've been talking about it for 40 years. So major problems about parity of esteem between mental and physical health. But this is the first time that the government has commissioned a task force, an independent body, to come up with recommendations. The public debate about mental health, as Ruby was saying, has been much better. People are much more comfortable about talking about mental health problems. It's gone up the policy priority list. Today, the Prime Minister is giving his personal backing. This is a very major opportunity to actually address some of the fundamental problems that we have.
Is there extra money being put into the pot, because out of the 8 million, suddenly something else will be squeezed out?
Well,
you know, this is a bigger, what is it that...
The billion is coming from the 8 billion the government always talks about, isn't it?
Well, if we look at this year alone...
Something else will be shortchanged, and then we'll have everybody up in arms too.
This year alone, close to £2 billion has been committed to mental health services.
Out of
600
the 8
million in the
million,
autumn
though.
statement. There's 1.25 billion is going into child and adolescent mental health, which is a big priority. We're seeing increased prevalence of mental health problems among children and young people, and transformation plans are being put in place.
But it's nowhere near, in truth, is it? I mean,
Yeah.
if 1 in 4 people at some point in time in their lives have mental health problems...
I can't say how much all this costs. You know, what
Exactly.
alarms me is, what if Paul Farmer hadn't made this report? Is somebody blind somewhere? I mean, the highest rate of suicide now is boys under 30. There's cutting in schools. All things emanate from the brain. You know, everything the government, you know, obesity, diabetes, heart disease, it's all because nobody's done research up
How
here.
do you
Why
think
now?
people have treated you since you sort of came out? If you
Well,
like,
I
and
was on
talked about
stage
this?
when I came out, so people couldn't really fire me. I had the show.
But have you felt have you felt sort of at all...
I feel I'm meeting my tribe, that it's a groundswell, that I open my mouth, and with these walk-in centers, other people will. And
not written off by anyone? You don't think
not
anyone's
anymore.
saying, well, that's...
Not
actually
anymore, but I
possible?
live in London. There's, you know, I get despairing people somewhere in Wales saying, I'm alone, my mother killed herself. I've been waiting, nobody will see me in A&E, and I go in there and say you have something else. Lie about it, because you will not be seen. It's still a huge stigma. In London, I'm fine on the stage.
I mean, this
I'm
is the
talking about the
problem.
rest of the country.
Isn't that because people trying to negotiate this very complex system and trying to ask for particular treatment are at their lowest ebb? They're at the worst point in their lives to ask for anything.
Absolutely, and that's why we need to have a lot more of what's called liaison psychiatry in the NHS. That is, when you walk into A&E with a mental or physical problem, that you are dealt with by a psychiatric team at that point. So one of the recommendations in this report is to have a further rollout of this liaison psychiatry across the country.
But do you
So
think
when
people should be walking into A&E?
they should be, their first point of contact should be crisis care in the community. But there are a lot of ways.
Where would you get that phone number?
Yeah, but there are a lot of ways in which people touch the system. So in an acute hospital setting, we need to make sure that mental and physical health are treated equally, and that means having psychiatric expertise co-located with A&E. That is fundamental to the front end of the
Well,
of
also
acute
the
hospitals.
GPs aren't always trained in psychiatric care. So
Absolutely.
what about all these guys throwing these generic M&Ms at people who are just a little sad? I mean, this is the dark ages. I'm happy you're doing it now. I'm just wondering, has somebody been in a coma?
No, but
Can I just ask you, we're sort of running out of time, but I just want to ask you both, I mean, how much optimism you have as a result of today's report? It's not going to suddenly change everything, is it?
There's some stark things in this report. We've got big challenges and prevalence of male suicide, middle-aged suicides going up. We've got indicators of difficulties in children and adolescent mental health. But for the first time, we have a quality public debate. We have this is a policy priority, and we've got commitment from the government to do it.
Yeah, if it doesn't work, I'm sure people will take to the streets, because I think there's too many people that have had it, and they've been underdogs for too long. So it's nice they're touching on it today, but God help them if this isn't rolled out.
Thank you both very much indeed. James Jones, Ruby Wax.
I've been getting away with it all my